Toxidromes are clinical syndromes which characterize certain common and commonly recognized intoxications and drug overdoses. These toxidromes can be very useful when we are presented with a patient who is unstable or uncommunicative. For example, they have altered consciousness and we're trying to find out what they have taken. This talk will go through the 5 commonly recognized toxidromes. We're going to use a case-based approach for this. So let's start with case 1. A 24-year-old man presents to the emergency department with chest pain. He looks pale with poor peripheral perfusion and is sweating profusely. He is somewhat confused and agitated. On examination, his heart rate is 145 beats per minute with a blood pressure of 196/105. His pupils are dilated but reactive to light, and his respiratory rate is 28 breaths per minute. So you can pause the video here and have a think about which toxidrome this might be, and we'll do that for each case. So this is the adrenergic toxidrome. Cardiovascular effects would include tachycardia, hypertension, peripheral vasoconstriction, and chest pain. CNS effects would include dilated pupils, agitation, and seizures, and there are other effects as well. Hypothermia, peripheral vasoconstriction, which might cause pallor, and rhabdomyolysis. Case 2 is a 44-year-old psychiatric patient who presents to the emergency department after having taken an overdose of his tablets. He is confused and agitated. His pupils are dilated. On examination, his blood pressure is 86/54 with a pulse of 128 beats per minute, and his ECG shows short runs of ventricular tachycardia. Again, pause the video, think about what this might be. So this is the anticolic toxidrome, often brought on by antipsychotic and antidepressant medications such as tricyclic antidepressants. Cardiovascular effects would include hypotension, tachycardia, prolonged QT interval, and the associated arrhythmias. The CNS is also affected. Patients present with altered consciousness, delirium, seizures, cerebral irritability, and dilated pupils. Other effects would include urinary retention, dry skin and mouth, and increased temperature. A 9-year-old child presents to the emergency department with abdominal pain, vomiting, and difficulty breathing. She is confused and combative. She is hypersalivating and has had several bouts of watery diarrhea. On examination, her pulse is 64 beats per minute, blood pressure 97/65, and respiratory rate 32 breaths per minute, with moderate distress. The patient is found to have pinpoint pupils. An auscultation of her chest reveals bilateral coarse crepitations. Pause the video, think about what this might be. What toxin may have caused this? So this is the anticholinesterase or organophosphate toxidrome. Patients present with bradycardia, although occasionally they may be tachycardic, and they tend to be hypotensive. They are confused, may have seizures, and their pupils are pinpoint. Other symptoms will include abdominal pain and hypersecretion leading to vomiting and diarrhea, hypersalivation, and pulmonary edema. And in addition, the nicotinic effects on the cholinergic receptors may cause muscle fasciculations and ultimately paralysis. Here's a 28-year-old British tourist who presents to the emergency department unconscious. She has needle marks on her forearms. withdraws from pain, does not open her eyes, and is only making incomprehensible sounds. Her pulse is 75, blood pressure 98/63, respiratory rate 8 breaths per minute, and her pupils are 2 millimeters and sluggishly reactive to light. Pause, think about what may be causing this. This is the opioid or opiate toxidrome seen after ingestion of heroin, methadone, or the use of other opiate analgesic drugs. Bradycardia and hypotension are seen, often not as severe as in some of the other overdoses. Patient does have altered consciousness with pinpoint pupils and sedation or somnolence. Respiratory depression is quite common. Finally, a 32-year-old male presents to the emergency department unconscious. She responds only to pain. The patient's pulse is 62 breaths per minute with a blood pressure of 102/54 millimeters mercury. Her respiratory rate is 10 beats per minute. Her pupils are 3 millimeters and reactive to light, and her temperature is 35.6 degrees centigrade. This is the sedative hypnotic toxidrome. The patients tend to be mildly bradycardic and hypotensive with somnolence and altered consciousness, but unlike the opiates, no pupillary changes. They may also have respiratory depression and hypothermia. If you have any questions, you can post them on the discussion board. In summary, we've looked at these 5 toxidromes: the anticholinergic, the cholinergic or cholinesterase, opioid, adrenergic or sympathomimetic, and sedative hypnotic. It is really helpful when you use these to determine what your patient may have been poisoned with if the patient themselves cannot give you the information.